Hello and a warm welcome to Eye on Gauteng. I'm Gugule Tucele. Transforming, modernizing and re-industrializing the Gauteng City Region requires world-class healthcare facilities for its citizens and visitors. Today we come to you from the province's Eastern Development Corridor, from what was formerly known as the Natalspruit Hospital and now the new Tele Mokgwerane Regional Hospital. Let's step inside and take a look. The new hospital opened its doors in 2014. It features a variety of world-class facilities and services, including 821 new beds, a 24-hour casualty, as well as a state-of-the-art Lodox full-body digital X-ray machine. This hospital is an emblem of Gauteng's future.
My name is Dr. Patricia Africa. I'm the acting CEO of the new Natalspruit Hospital. We relocated from the old hospital August 18, 2014.
My name is Dr. Nomonde Mkaimbambo. I am the clinical manager at the hospital. The biggest challenge that we experienced was that we're not yet prepared for the influx of the patient, because we started experiencing an overload due to the excitement of wanting to experience firsthand the new facility that has been highly advertised. So it gave us a bit of a challenge as our staff, but that led us to having to think outside of the box.
So relocating to the new hospital, we found that we have improved on the delivery or on the operations of our patients because there is no delay.
The new hospital actually is bigger and better from a clinical perspective because we have got more wards.
The hospital benefits the community in that it does have specialists in all the categories of care, from surgical department, internal medicine, obstetrics and gynae, accident and emergencies, and radiology.
We've got a state-of-the-art Lodox machine that assists us in screening our patients, particularly those that have been involved in car accidents, without having to go into long queues and wait for radiology service. We've got mammographs, which we didn't have in the past, which helps us diagnose early cancers in women. We've got sonar machines in accident and emergency, blood gas units. It has actually helped us to restore the dignity of our patients. There's nothing as beautiful as seeing an elderly lady walking tall and proud in this beautiful facility.
The vision of the hospital is to not only be a place that treats ailments, but to also serve as a community education facility in order to prevent further diseases and promote healthy living. When it comes to formal education and training, the Charlotte Maxeke Academic Hospital in Johannesburg is one of the leading knowledge centers in South Africa. It is a teaching hospital for the University of Witwatersrand and collaborates with other universities in Africa and beyond the continent. In April this year, the Gauteng Provincial Government's Social Cluster convened at Charlotte Maxeke's Cardiology Unit, which boasts the highest number of cardiologists in the country.
When the Premier spoke during the State of the Province address, one of the things he spoke about was the centers of excellence in our different departments in the province and in health. He mentioned the cardiology department. So we thought that as a post-State of the Province address, we should come here with journalists just to showcase you as to what these doctors and nurses are doing, and also to get a sense from and a feeling from the patients of what is going on in the hospital. And I think it humbles me to see so many of our very highly qualified doctors and nurses working tirelessly to save the life of the patients, and we can only say we're truly grateful, but I know there's areas of improvement and we need to invest more money on certain things, and we'll continue to look for options to make sure that patients are treated better.
The unit runs a comprehensive database with over 7,000 patients, unique to South Africa.
We can actually tell you the number of patients that in fact have had heart attacks, how many patients died, what the outcomes are, and we're now in fact delving further into databases to say how are we comparing ourselves to international standards as to what the patients are receiving when they get discharged. Are they getting the medication that is in fact prescribed by current world guidelines? And in fact, looking at our guidelines, more than 80 to 90% of our patients fulfill that criteria.
The chief specialist at Wits University's Department of Internal Medicine puts the future of South Africa's health into perspective and the pivotal role that Charlotte Maxeke Academic Hospital will play.
The biggest challenge in health in this country is infectious diseases, but almost certainly non-communicable diseases are going to catch up, if not this year, certainly in the next few years. So apart from challenging the health system with infectious diseases, which you all know about, we're going to have to face non-communicable diseases as an epidemic. And most patients with non-communicable diseases will have cardiac problems. So it's easy to say, if you've got a non-communicable disease, you're likely to die of a cardiovascular event. So I think the focus in creating tertiary centers of excellence to deal with cardiology diseases is vital, and we thank Department of Health. We thank our CEO for supporting us. So I think what's important too, as Professor Manga alluded to, is that what we try and do is to try and provide a cost-effective is we treat where relevant, we don't overservice. We want to provide that sort of service and build on that service by adding a teaching platform. So what we're saying is you can't train, you can't teach without a good clinical platform. So the clinical platform is good outpatients, good inpatients, good ICU, good theatre treatment. And this all boils down to subspecialists and how we train doctors, how we train nurses. So I'm proud to say this hospital, together with our sister hospitals, probably train the largest number of specialists and subspecialists in the country, both physicians, cardiologists, and surgeons. So perhaps I can focus on how this integrated teaching, training, service platform works. So a patient would start off with a heart problem, get assessed in cardiology, may need ICU, may need very expensive intervention in terms of the cath lab, which you'll see, maybe the pacemaker lab, and eventually may need surgery, cardiac surgery or thoracic surgery. And that's where our challenge in 2014 occurred, with training being deemed suboptimal by the Health Professional Council. So what we've done with modernizing theatre, modernizing our cath lab, modernizing the EP lab, is we've been able to turn that around very quickly. So we've doubled the number of open heart surgery between 2014 and 2015. The training program is back on track, and I'm happy to say we again the leading cardiothoracic unit in the country in terms of number of patients seen, both adult and pediatric, and the complexity of the operations and the outcomes.
MEC Qedani Mahlangu echoes the professor's bleak outlook, saying that Gauteng's health sector is facing some of the toughest challenges to date.
Increased number of patients who are sick with what we call the lifestyle diseases, and the heart-related diseases are one of them, including hypertension, which is high blood pressure, and diabetes. Those diseases, I think, are on the increase. And HIV and AIDS, of course, you know that in Gauteng we've got more than 900,000 people who are on ARV treatment alone. 60% of those would have TB, and so the number of people who are sick on a daily basis is getting increasingly high. We've got an increase on the mental health, and as well as we've got an increase related to depression, which also may lead into mental health. So the diseases that are in the hands of are in our control, which we can do something about and prevent, are on the rise because citizens are not taking responsibility of their lives and what they eat as well, about exercising as well as what they eat. So we end up having to deal with this. The levels of accidents are on the rise, trauma and violence. People are beating each other, shooting each other, stabbing each other, and all of those. So those things, the health system is dealing with the consequences of what's happening in society. And I think there is a greater role that society should be playing in just dealing with these things. You know that every Friday or every end of the month, the numbers of people who go to hospital because they are drunk, they've gotten behind the steering wheel, they're drunk and they beat each other and all of those, we can prevent those things from happening, because someone can choose to be drunk and sit at home or sit wherever they are, but choose not to fight. But South Africans behave differently, and I think there is a greater conversation that we need to have.
The rapid rise of communicable diseases such as HIV and tuberculosis have created a more aggressive approach in rolling out modern, accessible and affordable treatments to patients. But at times the province is faced with hurdles that can become critical in the sector. Earlier this year, a shortage of an antiretroviral drug in Gauteng caused widespread panic, with patients being turned away from receiving treatment despite the availability of a lower dose of the same drug. Antiretrovirals are available for free at public healthcare facilities in Gauteng, which has dramatically changed the lives of many people. This is Martina Mutaung's story.
I'm a long-time survivor of HIV. I was diagnosed in 2004. My name is Martina Mutaung. After realizing my status, I felt like a dark cloud has covered my body. Every person was just saying, oh, HIV positive, that means you've got AIDS, then you're gonna die. I found out that the government is giving us free treatment. After being diagnosed, I got a letter from the clinic where I was tested. I think they take my BP and my weight. After that, they go and check my pills. The doctor sees me and sees my progress. I like to say HIV and AIDS is no longer a death sentence.
The province has a bullish plan on coping with the rise in infections, with the added advantage of strengthening the country's gross domestic product.
In September this year, we will be finalizing, doing away with the CD4 count in terms of people who are HIV positive, which means that anyone who's HIV positive from tomorrow, whether your CD4 count is 1,500 or it is 2,000, you are eligible to get ARVs. What does it mean from a budget point of view? It increases our expenditure to buy ARVs. So currently we have Aspen, who's producing ARVs in PE. We have got Adcock, who's producing ARVs somewhere in Wadeville. They've got to expand. We've got Cipla, who's producing a portion of the ARVs in Durban. And one of the things which is very important, the point I want to demonstrate to you about manufacturing, when I spoke to the CEO of Cipla a while ago, he said to me, when they got a portion of the tender for ARVs from government, it took 10% production of the world capacity of Cipla. Just a portion of the turnover, not all of it, for Cipla to produce. So that on its own, it demonstrates to me that if we really strategically were to procure and focusing on companies that are located in South Africa, we are likely to create more jobs, not just jobs, quality jobs, because the manufacturing sector, the health sector, people are more sick, and of course we must focus on preventative health care, but those who are sick, who need medication, it's going to be cheaper to produce here and employ and create jobs, as well as and contribute to our GDP.
After the break, we take a look at healthcare innovations that are redefining this critical sector in the province. Stay tuned. Welcome back to Eye on Gauteng. Just last week, the CNBC Africa team visited the Charlotte Maxeke Academic Hospital in Johannesburg, where the Gauteng provincial government launched innovative, groundbreaking digital X-ray technology, the same that's used here at the Tele Mokgwerane Regional Hospital.
2014 to be exact, when the Premier took office, one of the things he said we must do as a provincial government and society as a whole, we must look at issues of modernization, transformation, as well as reindustrialization. And I think today we are here just to talk to one of the pillars, or a component of one of the pillars, which is modernization. Why modernization is important. All over the world, it is said that ICT should be at the heart of healthcare modernization. And if we want to see efficiencies, we want to see cost reduction, as well as just a better management of the services that we provide.
Moving forward with the province's long-term strategy, Gauteng Premier David Makhura praised the efforts that led to the newly implemented picture archiving and communication and radiology information system. The cost of the system accumulates to 50 million rand over the course of 5 years. It will create greater efficiencies, improve staff morale, decrease costs to consumers, and reduce the hospital's carbon footprint.
This is part of a dream we set for ourselves in 2014, that amongst the big things that our province must strive for is to the ideal of the modernization of the public services. Not just do things the way they have always been done, but as part of the world that is fast changing, new technologies coming to the fore, new knowledge coming to the fore, that we at the southern tip of our continent, we in South Africa, must find ourselves right there at the cutting edge of harnessing this technology to deliver the best public services to the people of our country, and in particular as Gauteng province, as the economic hub of our country, as the financial nerve center of our continent, have to pioneer this. So if there's new technologies for the health services to be delivered in a way we couldn't imagine probably a century ago, that doctors could not imagine sitting at different parts of the world diagnosing a patient and sharing knowledge, that if that can't happen in our province and can't happen in South Africa, it will not happen in Africa. And that's what you have to understand as Charlotte Maxeke Academic Hospital, that you are a pioneer and you must be the leader, not just in the public healthcare system in our country, but you must be a source of pride of our continent, Africa. So today, this event is very, very important. So the introduction of the PACS and RIS system here is cutting edge. It's cutting edge in intervention and innovation in our public health care system. That has been explained already by Professor Ngomezulu. It will change the way specialists interact, but it profoundly changed the experience of patients who interface with our healthcare system. And these healthcare services principally are about patients. And I think you know, patient-centered. It can be an exciting thing, as Professor Ngomezulu was saying, can be an exciting thing amongst experts, but if it doesn't change the experience of patients, it may just be something nice to have. So we want, in the end, that the patients who interface with our healthcare services must feel the difference of the investment we are making in knowledge, cutting-edge knowledge, the training, but also in the technology. Every time I go to a hospital, I get told we don't have enough professionals. So this technology must also help us. So the experience of patients is important. How long do they take when they come into our institutions before they are treated, before they are diagnosed, before they know what the next step is about their lives? But the workers in our system must also have this, there must be a benefit for them. They must feel that the burden is lighter. This technology has helped solve many problems in work structure, in workflow, that in the past they had to go through this process, that process, and then I know in our hospitals we've got places where there are files. In fact, I might be right to say one of the things that our hospitals are known for, that they have more paper. They have rooms that are full of paper, which rooms we are supposed to clear CEO and use them for something else. So all this stuff of files, I've seen them. It's a nightmare. Files are lost. And then you see there are clerks there who work in there, tortured by this themselves, having to look for this. That place where the files are packed is a nightmare in the hospital. So the experience of these workers too must change.
Local municipalities have also aligned their strategies to enforce the Gauteng City Region's broader plan towards modernizing the healthcare sector. Here at Jabavu Clinic in Soweto, the city of Johannesburg launched the first implementation of the electronic health record system called eHealth at Joburg.
We did a survey of the users of our clinics, and we asked the question, what affects you the most at our clinic? Actually, they did not complain about care as much as they complained about the queue. They complained about waiting times, about records, and about the queue. So how do you use technology to enable you to deal with that problem, to improve health care, to improve access, to improve the quality of service, and to reduce waiting times so that you are able to give a better service to the people? How do you ensure that you can keep records in such a way that, and I know many of us who are not medically inclined, you know, when you go to a doctor and they ask you, are you taking any medication? You say yes, and they say, which medication? Or yo. How do you expect me? Firstly, those things are written in some complicated English I don't know, and half the time you're asking me to answer this basic question. Now, this keeps the record on the system so that you are able to get, if you get your record on the system, the doctor would know what medication you're taking, what conditions affect you, and what treatment you're getting for the different conditions, and they are able to take the precautionary measures and the mitigating measures to deal with your condition, so that we don't have mistakes that are unnecessary.
The system is designed to drastically improve turnaround times, record keeping, and services in clinics.
Our clients would go to the health facility as early as 4:30 in the morning to beat the queue and to be the first on the queue, but they would also wait for long time, waiting on the queues, polishing the seats. And then the other challenge was that our health practitioners did not have sufficient time to focus on the patient because they had to fill in the records, fill in the forms. So all the manual system is actually very tedious to save time for the patient as well as the health practitioner. So we then thought as a city, through the executive mayor, who said that we need to test an electronic record system and see how best we can deal with these challenges that we are faced in our clinics. Especially elderly people, chronic elderly people would wake up very early in the morning, and that time the clinic gates are closed because we do not open the gates before the actual time of opening of the clinic.
The turnaround time from the time they came in to get to the file was about 40 to 45 minutes. Then they'd have to go and wait again for the first part of the treatment is vital signs, and that could be another 30 to 40 minutes depending on the numbers of staff or numbers of patients in the clinic, and depending on where they were routed to, there'd be another 40 to 45 minutes. So some of the stats that the city has is turnaround times from point of entry to leaving the clinic with your medication could be up to 4 hours sometimes. So this system will dramatically reduce those waiting periods, and that's going to make a massive change in the lives of the people that require these services.
Patients' records will be accessed via a biometric system which will record and reveal their details using fingerprints. A patient's information can then be accessed at any hospital or clinic in the region.
I must say that this system is very revolutionary. Because if the customer has an appointment, the customer then gets reminded by SMS, automatic SMS from the system. Also, the reports will be generated by the system. So our health practitioners won't be writing reports, sick notes. The system will generate all those. But what is more important as well here is about the confidentiality of the patient. because only people who have a code and who are authorized will be able to access the patient's record, especially the confidentiality of the patient, which is between the doctor and the patient.
Now in phase 1 of 7 phases, the system is currently being rolled out in 15 clinics in Johannesburg, with a further 15 planned for phase 2.
The implementation of such a system requires extensive change management. Together with the City of Johannesburg, we've got in place our staff who are on standby all the time for the entire rollout period. And there will be supporting staff throughout the process. So all staff undergo a week or 2 week extensive training process. Thereafter, there's on-the-job training as well. So that change management, moving from the paper file to the electronic system, is absolutely vital, and we have support staff to ensure that the nursing sisters are able to get help when they need help.
Revolutionizing healthcare services in the city, the eHealth at Joburg system will be implemented in 81 primary healthcare facilities in the coming months.
We've come to the end of this month's episode, but be sure to share your feedback with us on social media using @CNBC Africa, #IonGauteng410. Next month, we focus on infrastructural development in the Gauteng City Region. Be sure to tune in to find out how far the province has come since democracy and some of the future plans in the pipeline. From myself, Kukuletu Cele, and the team, it's goodbye for now.